Good evening, dear friends. Well, today I invite to the screens of your YouTube receivers all those who have problems with limited movement in the neck pain, neck tension, as well as headaches and dizziness, including numbness of the hands too. Today we will talk with you about how exactly you need to restore the mobility of the neck and how to properly stretch the neck muscles. Because very often the first thing that comes to mind to everyone who has problems with the neck is that it needs to be stretched. Because if you feel tension, the first thing that seems necessary to do is to stretch, it seems to many. But this is a mistake. But it's impossible to stop you. You still want to stretch it. Therefore, I need to show you how to do it correctly and which muscles are needed to be stretched. Because the worst thing you can do is to stretch the back of your neck like this. That is, the first, most common way to stretch the neck is to grab the back of the head and pull it down. Why? Because it seems you feel relief at the time, but in this way, over time, your head starts to shift further and further forward. Because you're not stretching the muscles that need to be stretched. And which ones need to be, you ask? Now let's list them first. The shortest muscles, those muscles that are prone to shortening in the neck. Today we will talk with you, by the way, about the shortening of muscles and how to remove this shortening. But also for the restoration of neck mobility, it is necessary to restore the tone of the muscles, their volume, restore the mobility of the joints themselves between the vertebrae. Here, the ones that are located here. Here they are, the intervertebral joints, all should move. And also restore the elasticity of the muscles. This is the stretch we will do with you now. And one more thing. One part of the exercises is the restoration of the biomechanics of movements, the correct sequential inclusion of muscle movements. That is, this is already another training. That is, there are several types of stretching exercises. For stretching, strengthening, restoring mobility, restoring biomechanics of movements. I have prepared all these exercises for you at the link in the description. In addition, I will now start a whole course that will be calculated for a whole year. Also, there will be weekly exercises coming out step by step through the link, which will allow you to restore not only the neck, but the entire spine and other joints. Therefore, friends, join us. Those who are interested, I'm waiting for you there every week. New videos will be published with exercises, explanations on how to determine what to do with the diagnosis, among other things. And we will also regularly answer your questions there. So, now we return to our muscles. This is the first thing. So what do we need to stretch after all? Let's list them in order of their, well, not in terms of importance. They are all important. How often do they get shortened? The first one is the levator scapulae muscle. Here it is right here. It starts from the first cervical vertebrae, the first 4 cervical vertebrae, and it attaches to the corner of the scapula. What happens when it is shortened? The scapula is lifted upwards and slightly shifted forward. In this case, the head also begins to slightly pull towards the shoulders. And visually in people with shortened muscle that lifts the scapula, the neck becomes shorter. But in reality, it's not the neck that shortens, it's just the shoulders begin to lift up, and the head begins to shift forward. It also shifts forward when the scalene muscles shorten simultaneously with it. There are 3 of those: anterior, middle, and posterior scalene muscles. It has a more rounded place of origin. That is, the anterior scalene muscle is slightly thinner. The middle one is a bit larger. What's the peculiarity? The peculiarity is that a neurovascular bundle passes between them, and when they are shortened, the nerves that go to the arm often start to get pinched. What does this cause? Firstly, it causes numbness at night in certain positions, for example, when the hand is in a certain position. When turning the head, along with the pectoralis minor muscle, It is a very common cause of numbness and weakness in the arm. Then, further shortening of these muscles causes muscle weakness, which first appears under strain and then even at rest. For example, you pick something up and it falls out of your hand. One of the very common reasons is the shortening of the anterior and middle scalene muscles. Also, when the levator scapulae muscles and the scalene muscles are shortened, there is a significant limitation of mobility in the neck. Why? Because, as we already know with you, we have levator scapulae muscles. It starts from the top 4 cervical vertebrae. And the scalene muscles are 2. They together, if taken, from all the cervical vertebrae at once, except the first one. Starting from the 2nd, ending with the 7th cervical vertebrae, they have attachment points. And when these muscles are shortened, there is a limitation of mobility. How will it manifest itself? There will be a limitation of turns, there will be a limitation of tilts. When tilting, there may arise, with any movements in general, various clicks, pain. In some cases, with some sharp movements, it is possible. That is, you turned your head once, something clicked there, and the head remained in this position. This also happens. Sharp spasms of these muscles also cause a kind of fixation in certain positions of the cervical vertebrae. Then they can't make the reverse movement. The muscles relax, then the movement is restored. So, friends, what now? How do we pull them? How do we stretch them out? That is, these are exactly the muscles that can actually be stretched, unlike the neck extensors, that is, unlike this exercise. Why, first of all, is there a desire to stretch the back of the neck? Because you want to stretch this suboccipital region, which is often tense. But what is it tense from? Also, first of all, because of the levator scapulae muscle. That is, its tension can cause such a reflected tension in the area of the occiput, even a headache in the area of the occiput, a temple in the temporal area can also occur. But also when the position of the head changes, when it starts to shift forward like this, an excessive load arises on this suboccipital muscle group. And what do we do now? Look, if we pay attention to how our neck can move, there are not many movements. What can we do with the neck? It's to bend forward, bend the neck, right? The head, and make a movement back. That is, this is bending, unbending. These are the first 2 movements. The second 2 movements are a tilt to one side, a tilt to the other side, right, left. The next movement, the third, is the turns, a turn to one side, to the other side. So, combining these 3 movements, we can stretch certain muscles with you. If we just tilt our head to the side, the upper part of the trapezius muscle will stretch more here. And depending on whether we tilt slightly forward or slightly back, the load here will already change. That is, if we tilted our head to the side with you and then made a slight backward movement. Here, the stretching of the middle and slightly anterior scalene muscles begins. That is, the first scalene muscle. How do we stretch it? We make a sideways head movement. No need to try too hard. You've tilted your head, right? It won't reach your shoulder unless you raise your shoulder. That is, we've made a movement. It doesn't go any further. That's enough. Stop here. Now make the second movement back here. From the position when you've already tilted your head, make a movement back. And in this position, the load shifts to your scalene muscle. When shortening the scalene muscle, you may feel some tension here in your arm or numbness in your arm. And if there's a hernia, there will be sharp pain in such positions. Stop now. This exercise is not appropriate for you. This is specifically for those who have muscle shortening. In acute periods of hernia or with large hernia, it is undesirable to stretch. There you need to strengthen more. We will do this with you. So, first, we tilted the head, made a backward movement. That is, as if we lifted the chin. All movements should be done in such a way that they do not cause you pain or discomfort. The amplitude of the movements should be determined, such that nothing hurts while doing it. There should be a light stretch. There should not be a strong stretch in these exercises. Don't try to make your muscles stretch as much as possible. Sometimes it happens that on the first day it stretches a little more, and less on the following day. Don't try to intensify the stretch. A light, small one is enough, especially when you're just starting out. So, this is the first thing we did with you. Incline and unbend. The second option is when you first made the upward movement, then start to lean. Here it will already stretch more on the front scalene muscle. That is, the difference, is that if you first stretched and then unbent it, here there will be more tension in the middle muscle, the middle scalene muscle. And if you first unbent it, because the amplitudes here are larger, and then you start to lean, it will pull more on your front scalene muscle. But try not to lift your shoulder at this moment. What's special about these muscles? The fact that they are attached to the ribs. Both the front and middle muscles are attached to the first rib. There is also a back scalene muscle that attaches to the second rib, and they participate in the movement of these ribs. That's why we can enhance the stretching of these muscles with the help of breathing. That is, you've made a movement to the side, now you've unbent your head, and in this position you can breathe. Take a breath in and out. On the exhale, the ribs will slightly lower and the stretch will intensify. Inhale and exhale. That is, if you don't feel the stretch too much, just breathe. You don't need to take a deep breath. Just continue to inhale and exhale. They will stretch on the exhale, so you can make the exhale a little longer. Next, we have the levator scapulae muscle. How do we stretch it? Look here. See what needs to be done. Here, we make a 45-degree head turn. We make a tilt. And we lower the head down. So, what movements do we have here? That is, we started with you with the incline for the scalene muscles, and here we start first with the rotation. You make a 45-degree rotation, incline forward, and add a slight incline at the very end. Once more to the other side. Rotation, incline forward, and incline to the side. So here's the last move. Rotation, incline forward, incline to the right, and the stretch happens in this position. Rotation, incline forward. And in this position, try to tilt your head a little more here. And at this moment, you have a stretch of the levator scapulae muscle. Sitting, it's done like this. That is, you just hold on to the seat with your hand. You can even take it better from behind, so that your shoulder turns like this. And from this position, you turn your head, incline it over. Some of you might even feel a stretch now if you've turned your shoulder well back. Even in this position, the levator scapulae muscles can already be stretched. If not, you can add a little tilt at the end here, a lateral one, to the side. That is 3 movements. Rotation, forward tilt, tilt to the side of the rotation. And while doing this, you hold onto the seat with your hand. If it stretches too much, hold it here. So, 1, 2, and 3. And in this position, you feel a stretch in the levator scapulae muscles. It can stretch depending on where it is shortened more for you. It might even feel like there's a stretch in the upper part here. Now, friends, I'll show you another way to relax these muscles on this front surface, specifically the scalene muscles. Make sure your head doesn't hang forward too much. For this, such pillows that are usually used on trips will be suitable. They are placed here like this, but we will use them differently. Take, for starters, 1 pillow. You can choose here. You can take 2 at once. Place them like this, one on top of the other, and just lie down on them like this. That is, you lie face down on them. And it turns out that the head, it is relatively, well, like the shoulders. of the rest of the spine. It will lift up like this, and at the same time, your scalene muscles will relax. In this position, lie down with your arms as comfortably as possible. Here, for the first time, you may feel a stretch in the upper part, in the middle part of the thoracic spine, exactly where you lack mobility. And because of this, your mobility in the thoracic spine will increase. Because very often when the head is strongly shifted forward, the thoracic spine stops moving. And so, thanks to this exercise, you can gradually increase from 1 minute, then 2, up to 5 minutes. And gradually the neck will start to take the necessary position, the position it should be in. This exercise is good for those whose head is strongly shifted forward like this. And when you lie down like this, your mobility will increase. In this part of the thoracic spine, the vertebrae will unbend. This is exactly the part of the spine, this upper part, which is often very immobile. And it's very difficult to restore mobility there. This exercise restores this mobility very well. After it, you will notice that this part, all of it, the front area of the scalene muscles, relaxes well. And it's as if your neck might become a little longer after this. Well, friends, try to do such a complex for stretching the neck muscles, but do it carefully. After all, stretching muscles must be combined with strengthening muscles and restoring mobility between the vertebrae. And I've prepared these exercises for you. Once again, the link is in the description. Go check it out. If you combine them, then mobility, of course, is restored much better. Because the muscles must be strong. Nothing ever shortens on its own. Shortening always happens because something somewhere has weakened, and another muscle takes the load. Well, friends, until new broadcasts.